I'm here today at the SEAK National Workers' Comp and Occupational Medicine Conference with Dr. Harris Allen of Harris Allen Group, an independent consulting firm. Dr. Allen, how can we expect the Affordable Health Care Act, the ACA, to impact workers' comp and occupational medicine professionals?
Well, the short answer is indirectly, but substantially. The Affordable Care Act has specific provisions in it that focus on health care in general and for employed populations, for those that are insured via commercial plans. It does not have any specific provisions in it dealing directly with workers' comp or for those services delivered by occupational health professionals that for causes that are deemed work-related. All this said, what's happening on the healthcare side is quite substantial. Major stakeholder provisions affecting how employers, health plans, and providers all go about doing their business. And those changes will affect how workers' comp and occupational health professionals go about doing their work.
And how is the system likely to change over the next few years?
We are likely to see greater rates of the uninsured becoming insured. We're likely to see the provisions dealing with employers specifically to continue to ratchet up their involvement, making sure that they can stay in the game with things like the Cadillac tax. We're likely to see health plans continue to use guidelines, in fact, promote guidelines for how healthcare should be delivered for various medical conditions, like, for example, low back pain, and to continue to promote them because they'll see that workers' comp and occupational health costs go down when those guidelines are followed. That said, of course, the Patient-Centered Outcomes Research Initiative that is also part of the Affordable Care Act that's dealing with and promoting comparative effectiveness studies, that's a wild card. We don't know. They could come out with guidelines that in fact suggest that utilization in workers' comp scenarios that pertain to workers' comp scenarios actually go up. And so that's a little bit of a wild card. Now, all of this is contingent on the Affordable Care Act continuing to unfold as it has been designed to unfold in the context of the legislation that's been passed and reaffirmed by the Supreme Court. We just yesterday had two federal appeal court contradictory decisions around the legality of subsidizing enrollees that get a health plan using via a federally managed health insurance exchange. So, the key word here is to continue to look at this as a work in progress. Things are still in flux, and so the provisions I've just talked about with respect to how things are going to be likely to change, that in fact could alter depending upon how things unfold at the legislative level.
So, Doctor, in light of all this ambiguity, how would you recommend workers' comp and occupational medicine professionals get ready for the impact of the ACA?
The Affordable Care Act was written and designed with two major goals in mind. One is to reduce the number of the uninsured. The second is to improve the value achieved by the United States healthcare system. Value here being defined by the outcomes achieved relative to the costs incurred, that ratio, which we in the United States do at best middle of the road on. We spend a lot more money per person on healthcare in our country than all the other developed countries in the world. Yet our outcomes are no better than average, if that. Life expectancy for at birth for United States citizen is literally 25th ranked relative to all other OECD countries in the world. So we're looking at a need to improve value in healthcare that actually preceded the Affordable Care Act. and is going to continue the impulse, the drive towards achieving value, greater value, is going to actually continue. It's not going to change. It's going to go on regardless of whether or not the Affordable Care Act continues. The vicissitudes at the judicial level with respect to it, these underlying currents are going to continue. So in light of that, what workers' comp and occupational health professionals can do is, number one, recognize that reality and in fact embrace it. In fact, try to step in and try to shape it. The Affordable Care Act remains a work in progress. Number two, one of the key ways to achieve one of the key aims of the value portion of the initiative, of the agenda for the Affordable Care Act, that is now reducing waste, actually calls for greater coordination of care across in a multidisciplinary sense. So you have a lot of different clinicians out there that are now coming together in new and different ways in the context of things like accountable care organizations and patient-centered medical homes. And they're figuring out how to collaborate. So what workers' comp and occupational health professionals can and should do is become proactive in seeking ways to establish new and different modes of collaboration with these multidisciplinary teams. That's a second mode, second thing that this community can do. Number three is the whole idea of recognizing the unique contributions that you bring to the mix, this community. And the way I would characterize that in broad-based terms is that you have a focus on functioning and role performance, the ability to contribute, that is unique among the clinical specialties. And that, in fact, I would suggest, is where compensation for healthcare is headed, not just in workers' comp and disability, but in fact for healthcare in general. We're talking about an iterative process, pulling back the layers of the onion. Right now, for example, we have outcomes measures that are being used to determine compensation for providers, hospital providers, and ordinary clinical providers in the context of various value-based purchasing arrangements. Now, the outcomes that are being used oftentimes are more clinical, psychophysiological parameter in orientation. You're not dealing with things yet like functioning and the ability to contribute, but that is what the purchasers want. At the end of the day, the people that are buying healthcare really want, what they're buying for their dollar is to support the people that they're responsible for are bringing under their coverage umbrella. You want them to contribute. They want them to function. And the reason they're buying the healthcare is to get them, is to assist them in better functioning. So the unique strength of this community is that you're already there. You're already focusing on that. And you have something, in fact, to impart to the other communities as they go about doing what they're doing, other physician specialty communities or clinical specialty communities. So in building on that strength, there is a debate that continues for the respect to compensation reimbursement in healthcare in general, but I would suggest it's going to be larger as time goes on. It has to do with the whole idea of measuring indirect costs, things like lost productivity and workers' comp and disability and absenteeism. You measure not only the drivers of these things, but also the costs that are associated with them. We haven't settled yet on the measures for those things. What this community can and should do, in my view, is step up to the plate and try to promote the standardization, the development and standardization of these communities, because of those measures, because at the end of the day, this is where this community can really shine with respect to the contributions it makes to healthcare.
Thank you very much.